welcome to another presentation for our wellness clinics that we're doing. We have Oakville Dental Care and Dr. Carey here to present for us. So let's welcome them and thank them for the good snacks and drinks this morning.
Good morning, everyone. Can y'all hear me? Welcome, and good morning. So glad y'all are here. We're so thankful to be here. I'm Dylan Carey with Oakville Dental Care. I know many of you guys, maybe almost everyone here, but if not, that's one. We have a dental clinic here at the Arc, and we also have a dental clinic over by the airport. So I've been here for 13 years at the Arc as a dentist. So I'm very thankful to be here, and we have a beautiful clinic that the Arc provides for us. So. Yeah, that's us. We actually have two different clinics. There's one at the Lakeside and then one here at Healthcare. And the Healthcare one was the one that got started first. So back in the 80s when they built the Arc, Dr. Osborne, Greg Osborne, he had a friend, or his mom had a friend that lived here. And so they got to talking and, maybe we should have a dentist here, and he started, I think, maybe it's a closet over in Healthcare. They gave him a room. He had to have a dental chair for a while. They just kind of in one of these chairs, and then they slowly built the clinic to what it is now. It's a beautiful facility. So that's the story of a brief story of Oakville Dental at the Arc. So, and we've been here ever since. So, but yes, thank you guys for coming. It is Oral Hygiene Awareness Month in October. So this is fitting that we're here on October 1st. To talk about some oral hygiene and oral health items here, but yeah, so we're very glad. So we wanted to talk a little bit about the factors that we have as we age, these factors that impact our oral health. In all different phases of life, there's different factors, and at the dental clinic, we see a lot of these things, and we're not going to talk about all of them today, but there's a couple here we'll talk about. So, so we talked a little bit about just our office here at the Arc since Dr. Osborne came in, and this is just a little bit more about me. I don't want to talk too much about myself, but I grew up in Lubbock, Texas, and went to school there and then went to college in Abilene Christian University. Any Wildcats here? Probably not. That's a small college in Abilene. Then I went to dental school in San Antonio and graduated in 2011, and very quickly came to the Arc after that. I've been here ever since. Yeah, I've done a lot of mission work throughout my years in dentistry, and also in college and university and in dental school as well. And maybe many of you guys know I like to rock climb, so that's kind of if you want to talk for hours about rock climbing, just come find me. I'm sure I've bored many of you before about climbing, but that is one of my passions outside of work and family. I have a wife and two boys, and they also climb too, so we're kind of a family that we like to get outdoors, and spend time outside. So that's a little bit about me. Dr. Sabino, of course, yeah, our resident dentist. I'm sure many of you guys know him. Probably needs no introduction, but he is served in the U.S. Air Force, and he's a wonderful person to have here at the Arc to help us with all the dental needs. If I'm at, Oakville is about 10, 15 miles away, and I've made many trips driving here, a quick trip for an emergency exam, but Dr. Sabino is here to help with that, and also on the weekends and all that. So he's been a huge help. Thank you, Dr. Sabino. And we also have here Jackie, our hygienist. She's right there. There we go. Yeah. So Jackie has been wonderful help to our practice. She's in the Air Force, Army. How long, Jackie? Are you in the Army?
8 years.
8 years. Hygienist in the Army for 8 years. So we definitely have that to bring you to the Arc as well. She's been trained in many aspects of hygiene and dentistry, and she's a wealth of knowledge. Please pick her brain today at the clinic, in the cleanings, whenever. She's very, very knowledgeable in what she does. So, let's see if this is gonna click here. Maybe. There we go. So as I mentioned, as we got started, there's a couple factors that I think are important just to talk about a little bit about dentistry, oral health, and as we age. There's a couple different things. A lot of people asked me already this morning, coming up to the table, about dry mouth. You know, dry mouth is something that happens a lot. We'll talk about. Periodontal disease is something else that, as we age, we need to kind of just keep an eye on. Some people have more factors than others for periodontal disease, and that's one of the leading causes of tooth loss is periodontal disease. So, and also just medications that we take have an impact on our health. And medications are good, and we take medications for certain diagnoses. And I would never say not to take medications, but they have impacts on our oral health, and so we'll talk about that a little bit today. And here we are, right into medications and oral health. So the biggest thing I think of when I see medications, and we have this term polypharmacy, many medications taken for heart disease, for diabetes, for all these different things. The one thing I think of is dry mouth with medication. So these medications that we take, even vitamins, all have different side effects. And so if you look at anyone's reading those labels on your medications, I know I don't read a lot of those, but you can put yourself to sleep reading those. If you read some of those, many of them say dry mouth. And the more we take, especially certain medications, the more that can kind of impact dry mouth. So maybe these two medications together, don't do a lot, but maybe this one and this one, all of a sudden, the dry mouth can come on really fast from those interactions. And so I talk about that a lot and see that a lot in our dental clinic here. Another thing about, we have some certain part medications that can cause gum growth, very, very large gum growths. And so that's a factor. And a gentleman asked about the change in taste. And the first thing I asked him was did you have any changes in medication? Because medications can affect our the taste of the foods. It can impact these different sensations we have in our mouths, burning tongue, all these different things can come with medications. So one way to I want to get to dry mouth here. So with dry mouth, I wouldn't, like I said earlier, I'd never say don't take this medication, because I didn't prescribe that to you. So that's not my purview there. But before we get to the ways we can fix dry mouth, here's some numbers on dry mouth. So over 60% of dry mouth sufferers have been diagnosed by a healthcare professional, which means there's 40% that haven't been. Over 85% of dry mouth sufferers are age 50 over. 73% of dry mouth sufferers mention having a sore or painful mouth when that impacts their daily life. 60% of dry mouth sufferers experience difficulty eating or speaking. 80% of those with dry mouth have tried sipping water. Medication is the main cause of dry mouth, nearly 30%. We kind of mentioned that earlier. 82% of people suffering from dry mouth have disturbed sleeping patterns. And 44% of dry mouth sufferers say that they have decreased socializing due to their dry mouth symptoms. So definitely, I think an impact here, something to talk about for sure. So the biggest thing that I see with dry mouth is, well, at least for my importance, is the risk of tooth decay. So if we have dry mouth, saliva helps to cleanse our teeth, to rinse our teeth. Saliva has factors in it that help fight cavities. And so we like saliva. We want lots of saliva. I have patients come in, I'm so sorry I have so much saliva. I'm like, yeah, that's not a bad thing. It's probably a good thing. But when we don't have saliva is when we start seeing issues with teeth. And just so you know, obviously without saliva, our mouth feels dry. It's called xerostomia. But other things besides cavities, sore, painful mouth, tongue sticking to your mouth, difficulty eating, sleeping, those kind of things. So for us, dry mouth can lead to cavities, and I see that a lot in our clinic. It's one of those things that's important that we talk about as we age, because as we age, I feel like there's more medications we're taking, myself included, and it also, when we age, the gums recede on the tooth a little bit, and that exposes the root of the tooth, and the root of the tooth has a high chance to get a cavity. And so that, added with dry mouth, is the recipe for disaster. So that's why we talk about this, this dry mouth. So here's a couple things that we just put on the slides, things to think about, maybe ways we can combat that. Stay well hydrated. I mean, so you don't have saliva. Well, water can at least kind of help rinse the teeth, cleans the teeth, and it's not a saliva substitute, but it can help. And water's very good. Water's very good. I mean, if you're drinking tons of other things, that can harm or increase cavity risk. You know, so when we say stay hydrated, I'm not, you know, don't drink 20 Gatorades. You know, that's not the best for you, at least for your teeth. Water would be definitely the way to go to help with dry mouth. Over the counter saliva substitutes. I say a lot of biotin out there. Biotin can help. It's not a cure for dry mouth, but it can help. We have some other things over here that are more almost prescription based that are really nice. We can talk about those. You gotta come ask us, please, afterwards. But biotin products over the counters can help. There's gums, there's rinses, toothpaste, mouthwashes, all sorts of biotin products help stimulate saliva. Avoiding tobacco, caffeine, and alcohol can help. Those things can dry out your mouth. Caffeine for sure can. Chewing sugar-free gum, candies containing xylitol. So there's a certain sugar called xylitol that's actually really good for your teeth. I know it sounds crazy, but it's like a sugar alcohol, and so there's lots of studies showing that it helps fight against the bacteria that causes cavities. So a lot of gum corporations, or gum companies are putting xylitol in their gum. So anytime you chew anything, our body is kind of programmed to give you saliva. And so if you're chewing gum, well, hopefully your body's kind of making saliva, and that can help with dry mouth. It doesn't fix it, cure it, but it does help. And then the xylitol also helps too. So I definitely always look for that xylitol when I'm buying gum on the ingredient package. Use a humidifier at night. If you're having dry mouth at night, maybe your mouth breathing can make your mouth really dry as well. Humidifier can help. Yeah, that's a pretty self-explanatory point there. I mean, I just think about my kids need dehumidifiers because of their allergies and things. So we have dehumidifiers, pulling out the water in the room, but there's also humidifiers that make it more not so dry in the air when you sleep. Periodontal disease is another one we're going to talk about. I actually have Jackie come talk about that because she is the leading expert in periodontal disease. And so I'll hand over to Jackie here.
So I am the new face of the hygiene over here at the dental clinic over at Lakeside. I think I met some of you, but not everybody yet. So I've actually worked with Dr. Carey for about 5 years. Previously, I was at another office with him, and when Nicole left us, he asked me to come on over, and I gladly agreed. So you'll be seeing me now. As far as periodontal disease, that is a main contributor as far as losing teeth. And as far as we get older, I know y'all want to try to keep your teeth as long as possible, right? And try to not get as many crowns or fillings, that type of thing. So I'm going to be pretty much helping you out as far as keeping your teeth as long as you can. So, all right. So what is periodontal disease? Periodontal disease is a chronic infection of the gums caused by plaque buildup. Now that plaque buildup actually grows every 12 hours. So when you brush your teeth in the morning, it's already back on the teeth by nighttime. So we definitely have to work on home care, okay? If untreated, it can lead to gum inflammation, tissue destruction, and eventually tooth loss. And so, so when you come into my chair, every year, you'll probably feel me doing the little probing around the teeth, right? So that probe is actually a little ruler, and that kind of lets me know where your gums are at, okay? So you can see nice healthy gum tissue over here, and then you can see where you got a little bit more periodontal disease going on that end there. So what we usually do, 3 millimeters is healthy. Anything higher lets me know there's something going on. And so when we have something that's going on a little bit more, there's things that I can do. I can do some irrigation. I can do something called Arrestin. It's a local antibiotic that I usually put on that area. So we can do some things, and then of course with home care. All right. All right. Did you know that 47.2% of Americans have periodontal disease? Yeah, and then 70.1 with periodontal disease is 65 plus. So that's pretty much our community here. Yeah. Oh, sorry. All right, and then connection with cardiovascular disease. Now, I don't know if many of you know, but a lot of the bacteria that's in your mouth can actually travel up to your heart and cause some issues there. So smoking, poor diet, diabetes, common risk factors in both periodontal disease and heart disease. That inflammation that I was talking about with the bacteria in the mouth that's going into the heart, it causes chronic inflammation from the gums, can contribute to inflammation on blood vessels, potentially leading to plaque buildup in the arteries. Okay. Bacteria in the bloodstream. The oral bacteria from the infection from the gums can enter that bloodstream and travel to the heart, leading to potential blockage and increasing heart attacks or stroke. So I want to keep you guys as healthy as I can as far as the oral health, okay? So it doesn't cause any other issues for you as far as your overall health. All right. So why does this matter? So diabetes, chronic periodontal disease, can interfere with diabetes management. Diabetes may change the pocket environment, leading to increased bacterial growth. Well, when it comes to diabetes, you think of sugars, right? So the bacteria that is in your mouth likes to feed off of sugars, right? So when you're eating all your stuff and your gums are bleeding, okay, what's in the blood if you're diabetic? Sugar, right? So it turns into a nice little vicious cycle. So you have to be very aware of that. So usually with my diabetics, I like to have them more on a 3 or 4 month recare so we can maintain that health, okay? A lot of times insurances will cover extra cleanings for diabetics. A lot of times they won't tell you that. You have to go out there and ask them. So, all right, and as far as proactive care, you gotta come into our office so we can actually see you, have a conversation with you, see what's going on with you. Everybody is an individual, so we have to try to incorporate what you need as an individual, because everybody is not the same. So we have to actually have a one-on-one with you. And then once we see you, we can put you on a nice little program, okay? All right, so just like it says here, regular dental checkups are vital for identifying, managing, and gum disease early. Good oral hygiene practices like brushing, flossing, using mouth rinse can help reduce harmful bacteria. If your medications are affecting your oral health, we can work with you, with your physician to manage your overall health. We have solutions for you. So that is our number there at our main office as well. And I think that was pretty much it. Another thing I wanted to talk about just a little bit, as far as the dry mouth, there are products out there that can kind of help it, to kind of protect your teeth. I do have some over here called Formax. I've been incorporating it into the office that we have because I didn't see that we didn't have any products. So I wanted to bring that to you guys from the main office that we have. That will definitely kind of help reabsorb the enamel, keep it nice and strong. As far as the periodontal disease, I have to get one-on-one with you to see what would be working for you as an individual. So it was nice meeting you all today. So hopefully to see you soon at a dental appointment.
Yeah, any questions, sir?
Can you go back 2 slides and talk about, you had a bullet point up there about heart disease?
Sure. Is this the first one?
Yeah.
Okay. Yes.
Can you just talk about it a little bit more? You talked about diabetes, but you didn't mention the other two.
Well, the heart disease part is basically that bacteria gets into your system. When your gums are bleeding, okay, if you're not keeping up with your home care, that bacteria basically can travel all the way down to your heart and cause issues with that. Especially if you're gonna have surgeries or anything other than that, that bacteria basically goes throughout your whole thing. So we just wanna try to keep the heart as healthy as possible. And it can start with the gums, because most people don't think about the teeth, right? The insurances think that your teeth are separate from your body, right? Yeah, it's not. So it can travel there, especially also if you have a hip joint replacement, a knee replacement, something like that. That bacteria can actually travel to that hip joint replacement or the knee and cause issues, make it to fail. So you gotta be real careful as far as keeping up with that home care, alright? So, and the stuff that you can't get at home with your brushing and flossing, I get it for you. So, yeah, so I help you out. You're a part of a team, okay? Did that help you?
Yeah, that's really important to talk about for sure. Yeah, and I in dental school we learned that you know as we went through school, over time these studies are coming out. These researchers are doing this research, and all of a sudden they tell us these things. And you know, maybe 30 years ago we didn't know that, but now they did this study where they found, you know, the mouth bacteria, which can be pretty specific. You know, not many other parts of the body have this certain bacteria. They found that in a heart valve or on a knee replacement, and so all of a sudden our radar started going off. What in the world? And then we start learning these things that. So, and a lot of times they're easy fixes. You know, you come twice a year, 3 times a year. You know, we're cleaning that tartar off. It's not a big deal. But if we get in this situation where we haven't seen it for for a long time, or maybe you're a person that builds more tartar, like myself, I do my best to floss and brush, but I still have tartar to clean off in 6 months. Whereas some of you guys, I know I've seen, it's not a speck of tartar anywhere, you know, and some of it's genetics and some of it is oral hygiene as well. But we want to clean that calculus and plaque off so that we can prevent that as much as possible for that happening. Yeah. So yeah, thanks for your question. I hadn't mentioned much about well, I talked about cavities and dry mouth, but yeah, there's things we can do to help prevent that. Other than we talked about the dry mouth, but yeah, Floramax, toothpaste, anything with fluoride. The tap water has fluoride in it. Over-the-counter toothpastes have fluoride in it as well. But our toothpaste that we have, prescription-based, has like 10 times the amount of fluoride, so it helps more with fighting those cavities from dry mouth, from recession, from periodontal disease, all these things. So, yes. Other questions at all? Yes, sir.
Yeah. A lot of people don't know about implants. Can you talk a bit about implants?
Yeah.
What they are, what you do, what you can't do, and so forth?
I can tie implants into this nicely, because an implant, if you guys don't know, is a way to replace a tooth. It's one of the best ways we have to replace a tooth, missing tooth. So we talked about periodontal disease. That is one of the main reasons we lose a tooth. And so there's numbers that we didn't put up here. I think over 70% of Americans are missing at least one tooth. And so that's, many of us in the room. And so, yeah, a dental implant can replace a tooth very, very, very well. They are the closest thing we have to a tooth, as far as a crown and a root and everything. It feels like a tooth, looks like a tooth. Maybe you guys have a bridge or a partial, and those are other ways of replacing teeth, and those are good as well. But the implant is just a newer, I say newer, in the last 25 years, I feel like it's really, really ramped up with dental implants. It's, I think, a little superior way in most regards to replacing teeth. So, thanks, Robert. Yeah. Any other questions at all? Yes.
How
coffee.
Coffee.
Every military officer ever went into.
Yeah,
had a
yeah.
cup of
Man, we
coffee.
gotta have the coffee. It's right over there, you know.
Coffee is
Yeah.
right here.
Yeah.
Well, what's so bad about it?
I wouldn't say it's bad.
Well,
Coffee, you know.
I saw it up
Yeah,
there.
yeah. Yeah, you know, I guess it's also moderation as well. Uh, Caffeine's been shown to dry your mouth out. So it can be a factor in dry mouth. Some people drink tons of coffee and they don't have dry mouth. You know, yay for you. You know, some people drink a cup of coffee and it makes your mouth drier. So I guess it's not bad at all. I love coffee as well, but just know that it can affect your dry mouth. Yeah, yeah, and it can stain your teeth. I talked to someone earlier about staining teeth, and again, it's not gonna hurt your teeth to be stained, at least that kind of stain. But that's a factor. But yeah. Can I get a cup of coffee real quick while we're talking? And another thing I think of, someone mentioned when they're sleeping, they have really dry mouth. And this is kind of off the point, not dental related, but I do know that if caffeine before bed could be a little rough. You know, one for sleeping, but two for drying your mouth out while you sleep. So, coffee in the morning, that's where it's at. You had a question. Yeah, that's a good question. I'm not opposed to it. There's it helps to kill bacteria, and her question was, how do you feel about using hydrogen peroxide as a rinse? So 50-50, half hydrogen peroxide, half water. And I said that I'm not opposed to it. A lot of periodontists still use hydrogen peroxide. I don't know, Dr. Sabino, if you know of any periodontists. That was a thing back, maybe back in the 80s, I'm not sure for sure, but using hydrogen peroxide to kill bacteria. I have this little theory that I'm not for sure, it's not studied, but the hydrogen peroxide is basic. On your scale of acidic, neutral, basic, it's basic, and anything that would correct an acidity in your mouth, I think, is a good thing. Hydrogen peroxide is our main ingredient in whitening. So when you go buy your whitening bleach, it's not bleach, of course, it's hydrogen peroxide, and that can whiten your teeth. And I'll never forget, there's a lady here, I can't say her name because this is HIPAA stuff, but she's a patient here at the Art, and every time I see her, she always reminds me of she's been using the hydrogen peroxide rinse since she was 15 years old. And I've never seen whiter teeth. For someone, I'm guessing, you guys maybe know what I'm talking about, so maybe she's 90, 92, and her teeth. She's in her 90s, and she has very white teeth, and maybe it's not due to hydrogen peroxide. It might not be hydrogen peroxide. There's probably some genetics. I'm sure she has excellent oral hygiene. But you got the hydrogen peroxide does make you think. I think it's probably helping her out. But yeah, I'm not opposed to it. It's pretty uncommon. I don't see a lot of people asking about it, but I don't think there's anything out there that it causes harm. Dr. Sabino, I mean.
It's just the oxygenation that perhaps kills bacteria, and as you said, it reaches your teeth. And
Yeah.
It tastes horrible.
It tastes horrible. Yeah. Maybe go home and try it, and then you'll just think, yeah, it's definitely not coffee. But she rinses with it. She said she's done it every day. I don't think she's mentioned she hasn't really missed a day in 90 years or 80 years. But anyway, good question. Yeah, that's fun question. Any other questions at all? Well, thank you guys so much for listening, being such an attentive audience, and thank you all for seeing us in the office and for your loyalty. Thank you so much. Thank you.